Hello, you guys. My name is Miguel, fellow Xray Tech peep here. Just giving you some knowledge of what to expect when you're out there on the field. I would say the bad things, well, not bad things, but stuff maybe you don't like. Just trying to give you a heads up, either if you are Xray Tech student or you're just on the borderline. Do I want to be Xray Tech? Do I want to be nurse, PT, different things? Just here giving you the facts, because a bunch of times you either go into it. There's been a few people that literally went 1, 2, even 3 semesters in Xray Tech school, and then they're like, you know what, I can't do this. I didn't want to do this. I didn't know to expect that. So I'm trying to save you time and money. So I would say, me personally, I don't like enemas that much. I mean, I'll do it. I know how to do it. Personally, some people don't like doing that, but that's one of the things that grosses a lot of people out. A few people got out because of that. So enemas is something a lot of people don't do, because all the body fluids and stuff like that. And then you'll have also blood. If you're not willing to touch, I mean, of course you're going to be wearing gloves and stuff, but if you're not willing to deal with people with blood, gunshot, all the other accidents and traumas that happens, that's something you'll just have to do. I mean, if you're in surgery, you're going to see people cut open, and they're working on them. They're like, take an X-ray of this, take an X-ray of that. You have to be, some of the smells, burning skin, when they're, cutting them open and stuff like that. And surgery, got to be ready for that. Some people don't like that smell. Surgery is cold. It's like a complaint a lot of people have. Personally, I like cold. It's like real cold. That's something else most people don't like. I mean, with every X-ray, more in general, any place you'll go, we have to work as a team with people. Of course, there's going to be people who are more slower, who don't do things right, and there's a bunch of technical stuff that for day to day you have to deal with. It's normal. Sometimes, I mean, you'll go out to work and maybe the equipment isn't as proper or up to date as you would like. That's another complaint a lot of people have. I mean, lunch break, sometimes I've noticed that either, if you get lucky, some places will close down an hour. Other places literally you'll maybe get 30 minutes. Other places, if it's slow, you can eat. If it's not slow, well, then I hope you have snacks or something to eat in between exams and stuff like that. The patients, you'll very patient. Certain people come in and they'll ask a lot of questions. They'll be in pain. They will maybe, because of lack of personal hygiene, because of their condition they're in, smell sometimes. People come in with jaundice, come in with wounds and all that, and there's a lot of bodily stuff that you just have to deal with. Put on gloves, slap on a mask, cover your board. A lot of blood, a lot of stuff like that you'll have to deal with. Sometimes the nurses aren't always the most friendly. Even my lady, she's the nurse, she'll always be complaining about stuff, and I'll tell her stuff I complain about, and we're just like, well, what can you do? What else is a big thing? I would say, sometimes people come in with accidents, stuff stuck in them, especially if you work in the ER. You'll find a lot of crazy stuff that happens. But yeah, I mean, I think that's the main gist of stuff that I could think of that a lot of people kind of are iffy or cause them to drop out of the program, or maybe they just don't feel safe being out there doing certain stuff, don't feel comfortable. Because a lot of people, if you don't know nothing of X-rays, and you just know basically common knowledge, and you're just a common person, you just think, oh, they have their little board, they come slap the patient on the little board, take a picture of them, and that's it. And it's not, you have a bunch of other stuff that you don't even think of, like especially my wife as a nurse. Before, she just thought I was really just a button pusher, didn't do much until I started explaining her, and she saw with our kids that got certain exams done that it's a lot more complicated. There's a lot of things, but yeah, hope this helps you. Whoever out there, once again, I just do this to share knowledge, help anyone out, because there's not a lot of videos, especially when I was looking up, and I wish someone else would do it, so I do it. And yeah, it's been your boy Miguel, fellow Xray Tech Peep. See you in the next one.